Welcome to Prominence Health Plan Provider Training. My name is Kelly Asher. I'm the Director of Network Management, and I want to be the first to welcome you to Prominence Health Plan as a participating provider in our network. We are so happy to have you, and we look forward to 2021 in Palm Beach County. We're going to have an overview of Prominence Health Plan, go over eligibility and member benefits, prior authorization requirements, our useful provider portal and how to utilize it to its fullest, the provider manual, vendor network providers, provider documents and all the helpful tools we'll make sure you have access to, and future provider trainings for more virtual trainings and in-office trainings when requested. Overview of Prominence Health Plan. So the counties we serve for 2021 is going to be Palm Beach County. So what this means is that a member must reside in Palm Beach County to be eligible for Prominence Health Plan. A lot of times the provider offices have offices in Palm Beach County, but they also have offices in the bordering counties of Broward, Dade counties. So a member has to reside in Palm Beach County, but they can go outside of the county to receive services. So if they live in the southern part of Palm Beach County, and it's closer for them to go into Broward to receive services, the members can do that. Prominence Health Plan website is a useful tool for providers. So once you log in, under the For Providers section, it has all of our up-to-date information. So if you want the most up-to-date provider manual, quick reference guides, prior auth requirements, this is the place. This is where we'll always keep our most up-to-date documents. So keep that in mind, bookmark this page, prominencehealthplan.com. So when a member signs up for a plan, they must choose a primary care provider, a PCP that is going to be their main PCP. Referrals are not required. Prominence Health Plan does not require any referrals for any in-network provider. You heard that right, no referrals. Prior authorizations are required for certain services, and all out-of-network services do require prior authorization. Unless it's an emergency, matter of life and limb, they have coverage worldwide. But for anything else that's out of network, a prior authorization is required for out-of-network services. Eligibility and benefits. Sample member ID card. So this is a sample of what the member's ID card is going to look like. So when they come into your office on January 1st, 2021, this is the card they're going to present. I always say that a possession of ID card is never a guarantee of benefit. Always, always, every time the member comes in, always check eligibility and benefits prior to seeing that member. Anytime a member terms with us, is no longer eligible for Prominence, we don't go back and collect that ID card. So just because they have an ID card does not mean that they're currently eligible with Prominence Health Plan. So always, always check eligibility prior to seeing the member every time. To check eligibility, the best, quickest way is our provider portal, which is available 24/7, and we'll go into that a little bit later of how to do that. And then you can also call our member services, provide the member's name, date of birth, social security number, any of that information, and they'll go ahead and check that eligibility and benefits for you. No hold times or things like that on the provider portal. So provider portal is the preferred method, but you can call member services as well. Benefits. So we're just going to highlight some of the top benefits that the members have because they're amazing benefits and we're very proud of it. So we call this the zero plan. So PCP, specialist, inpatient, urgent care, skilled nursing, it's all $0. So when the member goes and sees their PCP, no copay, $0. They go and see a specialist, no copay. Inpatient hospital, no copay, $0. Emergency care does have a $120 copay if they go to the ER, but if they're admitted, that copay is waived, $0. They do have a maximum out-of-pocket or MOOP of $2,000. So that means that $2,000 is the max that a member will pay out of their pocket. Skilled nursing, days 1 through 20, $0. Part D, that's their pharmacy benefit, $0 for tiers 1, 2, and 6. So 3 tiers of pharmacy medications, $0. They also have an over-the-counter supplemental benefit. So what that means is every single month, they'll get $35 to spend on any over-the-counter items like aspirins, vitamins, Tums, antacids, things like that. They get $35 every month to spend. Amazing benefits. A couple more of the supplemental benefits that our members have are dental. So they get $2,000 in dental benefits, vision, $0 for routine eye exams, and they get a $150 eyewear benefit. So $150 goes towards any glasses or contact lenses. That over-the-counter benefit we talked about, $35 per month. Silver and Fit is our fitness vendor. So what that means is that a member gets access, $0 free gym membership to any Silver and Fit participating location. So for hearing as well, hearing is another supplemental benefit they have. $600 per year they have for hearing aid allowance. $600 per year, that's $1,200 total they get for hearing aids. Meals, they get 14 days, which equals 42 meals that they get. And then transportation. We don't want transportation to be a barrier of why a member's not receiving medical care. So we offer 20 trips per calendar year for members to go to their doctor's visits, to go to the pharmacy, anything like that. We don't want it to be a barrier. Transportation can't be the one because 20 trips per year, zero cost to the member. Prior authorization. So certain services do require prior authorization. So once you've identified a procedure you're going to perform that requires prior authorization, and we'll be sure that your office has a list of the procedures that do require prior authorization so that you can identify those. There's two methods to submit for prior authorization request via the provider portal. Fastest, easiest way to do it is the provider portal for both you and us, Prominence. Or you can fill out a form and fax it in along with the medical records. If you do it via the provider portal, all the patient's information, everything's pre-populated for you, so you don't have to handwrite it in on a form. But if you don't have access, there is another way. Provider portal is preferred, but there is a fax method as well. So once you submit prior authorization request, the average time frame for standard request, Medicare allows us up to 14 days to make a decision. That's what Medicare allows, and we have to do that within 14 days. Prominence normally does not take the full 14 days. Sometimes if we have to go back and forth with requesting medical records, things like that, if we don't have all the information we need to make a decision, that's where delays can happen. So be sure when you're submitting that prior authorization request, you're giving us all the information we need to make that decision. So once you fax all that information in or submit it via our provider portal, we on average take anywhere from 5 to 7 business days to make a decision. The more information we have, the quicker we can make a decision. We do have an expedited request method. So if you feel that waiting for the average time frame could put the member's health and life in jeopardy, you can ask for an expedited request. Expedited requests are processed within 24 hours of receipt or next business day. So again, those have to be classified as waiting the normal time frame would put the member's health into jeopardy. If that's the case and it's an expedited request, please ask for so appropriately. It's always good to contact the department at 855-969-5884 if you do have an expedited request, just to make sure we have everything we need to make that decision. Claims. So for claim submission, there's 2 ways that you can submit claims. You can do so through our EDI clearinghouse, which is Change Healthcare. Our payer ID for the Florida Palm Beach market is 83352. So that's a payer ID that you need. Or you can mail them in to the address that's up on the screen. That address will also be provided on our quick reference guides, provider manuals, and it's also on our website. EDI submission is the quickest, easiest way, but you can mail them as well. Now, once you've submitted the claim and you want to check status of that claim that you submitted, there's 2 ways you can do it. Via the provider portal, again, easiest method for you, but you can also call into member services and they'll be able to provide you status as well with providing member information. They can provide status. Provider portal is, of course, the easiest, quickest, and available 24 hours a day, 7 days a week. Provider portal. So let's talk about provider portal. Let's dive in and show you guys high level all the amazing things that you can do within the provider portal. So this is what it looks like. So to log in or register, The prominence.aneocare.com is the link that you need to type into your browser, and that'll take you to this screen. So if you're already a user and you've already registered, you just log in. If this is your first time logging in, then you need to register. So at the bottom, request provider access, click that and register to become a user on our provider portal. Once you get into the provider portal and log in, this is your home screen, or kind of like your dashboard. This is what it looks like. So there's helpful links of contact us for provider relations, customer service, utilization management, all the important things that you need to know, quick links, things like that. And then we're going to go across the top, all the menu options that you have available to you. So your dashboard. So this kind of has all of your Prominence membership summary. So you have the membership summary compare, HCC risk score distribution, HEDIS care gaps, things like that are all available here on this main dashboard screen. Very helpful and useful information. To search member eligibility, you would do that under the member tab. So you can search member eligibility here by the member number, by last name, first name, date of birth, or by providing their Medicare beneficiary identifier. Either way gets you access to check eligibility and benefits for members. And then claim status. You can't submit claims via the provider portal, but once you've submitted the claim via EDI, electronically, or through mail, and you want to check status of the claim, that's where the provider portal comes in. So you can search by claims by member, or you can search by claim number. Either way, easy and super helpful. Requesting prior authorization. So within the portal, you can request prior authorization, and you can also check status once you've submitted prior authorization. So with the drop down here, you just select which one you want to do and continue on from there. So search authorizations by member ID, search authorizations by member last name, first name, and date of birth. And then you can also check by that Medicare beneficiary identifier as well. And then you have these modules. We have certain little modules that you have available. This is how you manage your provider user list. So anytime we have a brand new provider on the portal, they register as a super user, and then that super user is then responsible for adding every user under that provider's tax ID. So this is how you manage that, the provider user list, and our provider relations reps can definitely help you navigate the screen if you need help with that. So lastly, within the provider portal, you have access to the quality reports. So if you're a primary care provider, this is where you're going to access all of your quality reports. Your provider relations consultant will definitely be out to your practice to educate you and train you on how to access all of these documents and all of this useful information. The provider manual. Within our provider manual, it's going to have in-depth details of all the things that you need to know for provider responsibilities, our credentialing requirements, member eligibility, services, utilization management, how to request peer-to-peers, things like that, medication management. If any medications require step therapy, this is going to be the place that describes in detail how to get that step therapy information, claims, appeals and grievances, addresses, phone numbers, things like that. Vendor network providers. So Prominence Health Plan partners with many vendors to provide our members with their supplemental benefits. So MedImpact is that purple M symbol on the screen. So MedImpact is our pharmacy benefit administrator. So they're the ones that administer our Part D, our pharmacy benefit to our members. Silver and Fit is the vendor that we use that provides free gym memberships to all of our members. Sometimes if a member is unable to make it to a gym or is chair-bound, wheelchair-bound, things like that, an alternative to them going to a gym is to request an at-home video where that they can do exercises in the comfort of their own home. So amazing benefit there. National Vision Administrators, that's who's going to be administering our vision benefit. So for that routine vision exam and for the eyeglass benefit. Hearing Care Solutions is who we're partnering with for our hearing aid benefit. So again, $600 allowance per ear, $1,200 total through Hearing Care Solutions. GA Foods is who we are using for our meals benefit. So again, those members get 14 days of meals through GA Foods. Liberty is our partner for our dental benefit. So once again, $2,000, amazing dental benefit through Liberty Dental Plan. So those are the provider network that we use is through Liberty. So the member needs a dentist, they're going to go through Liberty Dental to find a participating local provider. Provider documents. We want to make sure that you guys have all the information you need to administer Prominence Health Plan in your office. So after this call, we'll be sure to send you guys a copy of our quick reference guides, prior authorization list, so that you're aware of what procedures actually require prior authorization. The prior authorization form. So if you don't want to request it through our portal, again, easiest, quickest way, you can fill out a form. So we'll be able to provide that to you. Our provider profile sheet. Anytime you have a new provider joining your group, we want to make sure we know about it. So you'll fill out a provider profile sheet. We'll make sure you have an electronic version. That provider manuals can get pretty big. It's 50-something pages. So we'll provide you an electronic version of that provider manual. Provider demographic change form. So if you have any changes, a provider leaving your group, change of address, adding an address, anything like that, you would complete that provider demographic change form and submit that to us. And then mail order pharmacy form. So for an added convenience, we have mail order pharmacy available. We can provide that form to you. So when writing a prescription for one of our members, you can go ahead and fill that out. Provider training. So obviously you're attending this training. So this training is pre-recorded, but you have the option to train a live virtual training. If you have questions, if you want to interact with others, you can attend any of our virtual trainings. Those are going to be every single Thursday and Friday. So every Thursday at 5:30 p.m. and every Friday at 12:30 p.m. So you have to RSVP ahead of time, and we'll send you the WebEx invite so that you can join that WebEx. Or if you'd rather have somebody come out to your office and do in-office training, that's available as well. So you can email our provider relations or call our provider relations team to schedule to have somebody come out in office and get you the training you need to make sure that you guys are successful in administering and seeing Prominence Health Plan. And we've come to the end of the presentation. So once again, I want to thank you guys. Thank you for being a provider in our network. And we look forward to partnering with you in 2021.